If they were retiring, would they be yeses on this bill?
Well, they would, no question about it, Katie. I mean, this is just an example of how complete the purge is now with his retirement and Don Bacon's announcement, the congressman from Nebraska. The irony here is that it's a short-term gain for Donald Trump, and it's just shown, unprecedented political strength that he's been able to do this. But the problem is that he's taking people out of the party who are willing to speak the obvious truths about the cuts that are going to hurt their own constituents. So he's eliminating the people who would actually help him in the longer term, in the midterms, and probably 2028. He's trying to keep Donald Trump from hurting himself and the party, and yet they're the ones that are taking off.
It was astonishing just to look back and see all the times where you saw a Republican make an impassioned speech on the floor, and nearly all of them, Mark, were either on the verge of retiring or had just announced their retirement. It's been pretty consistent for the past 10 years that, and other than for brief periods while Donald Trump was out of office and looked like it was maybe going to be hard for him to make a comeback, Republicans have just been terrified of publicly going against him.
Well, they have, because the pain is just is too much. First of all, they can't run for re-election because they know they're going to be primaried. And it's just an incredibly unpleasant job to be in a body where they can't even mention the word compromise or consensus or working across the aisle, because you'll get pitchforked by the MAGA tribe for speaking out against the president, when really they're speaking out in a way that in a long-term way would help the president strategically. They're just trying to save him and the Republican Party from themselves. And I think in the long run, because of this big budget-busting bill that's going to go through, that a lot of Republicans are going to go down in the midterms and in 2028, because there's going to be huge consequences from this bill, the kind of consequences that Thom Tillis and Don Bacon are trying to save them from.
Yeah, I mean, I understand not wanting to be primary, John, but I mean, I wonder if these Republicans would have an argument to try to run as independents. I mean, if you were talking about compromise and you're worried about your state turning blue, as Thom Tillis might be, North Carolina is going to be a competitive Senate race. He might not be able to win a primary against Republicans, but I think it's probably an open question whether he'd be able to win as an independent. The reason I said sad about that speech was not because of the policy. It's not, I like red, I like blue. It's just sad that there's so few senators who feel like they can speak honestly about not just their opinion, the facts of the bill in front of them. I find that hard, especially in the Senate, which has long had, up until recently, a history of being a more compromising body, a body that takes their job more seriously. There's not a lot of, bomb throwing in the body, not like the House, where things get done. And that does not seem to be the case any longer.
No, it does not. And remember, this is the chamber where historically some of our most honored members of the Senate, most honored political figures, are those who have stood up to their own party in a time of challenge. Margaret Chase Smith standing up to McCarthyism when Republicans were in the White House and quite dominant in Congress, and others all the way through. Now we have what Bernie Sanders describes as a cult. Right? A political party that is so enamored of, so in fear of, and those are two different things, Donald Trump, that they will do his bidding even when they know it is particularly damaging. Now, you ask this very good question about whether Thom Tillis, as an example, could run as an independent. That would be pretty hard in North Carolina, because Thom Tillis is really a very conservative Republican. I mean, he's not some, classic moderate. He's been kind of described as a moderate more recently because he's willing to do bipartisan compromises.
Good point.
But he's quite conservative. There's a very popular former governor who's likely to run as a Democrat. A Republican would be nominated, very, very right wing. And I think Tillis might be squeezed there. But I mean, look at the example of Lisa Murkowski. She is someone who, when she was knocked out in her own Republican primary, ran a successful write-in campaign as effectively an independent. I think there's others who might be able to as well. But our American political system is not very generous to independents. And so this moment has caused most of these very sophisticated, very experienced political figures like Tillis, who's a former Speaker of the North Carolina House and who really does want to govern, to just decide you can't govern anymore. And so he's leaving, not looking for an alternative route in as an independent, but going home to North Carolina.
All right, let's get down to the nitty gritty of this bill and talk a little bit further about why Tillis made that impassioned speech, why he felt he needed to chide his Republican colleagues about the bill they were voting for. Dr. Gupta, explain what this would mean for people on Medicaid across this country, including Thom Tillis' state of North Carolina.
Yeah, absolutely, Katie. You know, I think so much of the focus so far has been on work requirements and somehow, focusing on those that might be without the proper documentation in the United States getting access to Medicaid. And that is a distraction from the crux of it. And that's exactly what Senator Tillis was bringing to the fore, this focus on provider taxes. It's a complicated topic. We don't talk a lot about it. And as a result, the focus isn't on it. But let's try to break this down. Provider taxes, this is basically the state levying taxes on hospitals and other healthcare entities in a given state that's expanded Medicaid so that they can ask the federal government to provide matching funds. And so without those taxes, we wouldn't get federal government to provide matching funds. And so hundreds of millions of dollars available for Medicaid, reaching, by the way, 70 million plus American adults would suddenly go away. And that's what they're doing here. They're decreasing the amount of provider taxes over time by 10% year over year. So it's going to be minuscule by the time this takes by the time it fully matures, Katie, the middle of next decade. They're taking away the lifeblood of Medicaid in these states across the country, but especially in the 41 states that expanded Medicaid. And so what does this put into risk to make this real for all families that are reliant on Medicaid? 70 million plus, by the way. This is not just those without, say, the proper documentation. This is everybody that relies on Medicaid. It's putting to risk skilled nursing facilities. These are places that are 1 in 5 hospital discharges, Katie, go to a skilled nursing facility for continued management for a patient's needs. 1 in 5 hospital discharges across the country. This bill is expected to result in the closure of 25% of the United States skilled nursing facilities. That is a big, big deal when it comes to where do we send these patients? And then ultimately what happens to emergency rooms across the country? They're going to be the places where patients end up needing to stay because we have no place to send patients for continued rehab. So that's one. 2, over 300 independent hospitals are expected to close as a result of state-directed payments and decreases to state-directed payments and these provider taxes. So we don't talk a lot about these concepts. I know they're a little bit more complicated. These are what's going to impact every single person on Medicaid. We should be talking about it as much as possible.
Also, preventative care and early intervention. Let me just read this to you from an op-ed about Alaska and what this bill is going to mean for Alaska. This is from an independent and a Republican in Alaska, Bryce Edgman and Kathy Giesel. In order to make up for this cost-shifting legislation, Alaska would need to find its already stressed budget hundreds of millions of dollars for Medicaid and tens of millions for SNAP. Such cuts could not come at a worse time. We're already struggling to stabilize our budget amid sharply lower oil revenue and a decade of out-migration. If this bill passes, it will mean less money for road maintenance and snow clearing, larger K-12 class sizes, school closing, and the defunding of state public safety agencies. Alaska cannot afford to lose health care funding. Our state is near the top of the list for the highest rates of suicide, tuberculosis, and sexually transmitted infections in the nation. It is also severely lacking in adequate behavioral health services. The cuts will only make these problems worse. And on the point for roads, money for roads, if there is less money for roads, it means it's harder to get to medical facilities. And Dr. Gupta, that means getting an appointment for a preventative issue or an early intervention issue doesn't become a priority. You go to the ER as a last resort, and that's where care is most expensive.
Beautifully said, Katie. That's exactly right. This is going to impact early intervention, early diagnosis for mental health conditions, for chronic disease, for infectious diseases. And as a result, and again, the state direct payments piece, they don't want us talking about this. It's work requirements, undocumented. That's easy to talk about. They're distracting from this. Exactly what you raised. State-directed payments, the ability of Medicaid to support safety net providers that are the lifeblood of Medicaid. That's what they're gutting, and that's exactly what's going to be impacted early intervention.
So that's the healthcare part of this. Justin, let's talk about the economic part of this. The Senate version of the bill, according to the CBO, would add $3.3 trillion to the deficit. Does that concern you?
In a word, yes. It concerns me because the starting point already is very, very bad. The budget deficit in the United States is higher than at any point in our history until the financial crisis. And then we had the twin crises of the global financial crisis and COVID that really blew things out of the water. But it's currently at a level that our parents had never heard of. And then this bill will add to the deficit quite substantially. What worries me as a person, not just an economist, is the outright dishonesty about what's going on. There's some tricky accounting going on to try and pretend otherwise, but the CBO is the nonpartisan scorekeeper, and it says, and it's absolutely right, I've looked at the figures, that this is going to blow out the deficit. It's going to raise the debt, and that in turn will raise interest rates for all the folks who are watching at home. So next time you go to take a mortgage, a car loan, repay your credit card, and you see the interest rate has snuck up a bit, you can thank Congress for that.
What about the tariffs? Is that going to offset any of this?
Well, depends what you mean by offset. So if we had mile-high tariffs that would cripple the economy, absolutely that could bring in a lot of money and offset some of this. But let's think about what that means. That means we've offered tax cuts to the rich on the one hand, and we're going to pay for it with tariffs, which sounds terrific if you believe that tariffs are really a tax on China. But the reality is that tariffs are an import tax on Americans. And because tariffs are a form of sales tax, they hit working and middle-class Americans harder than they do the rich, because working and middle-class Americans spend a larger share of their income. And so this is just a whole big part of a shift from a situation in which the rich pay a good chunk of taxes to trying to make the poor pay more and the rich pay less.